1 in 8 men suffer from depression. Men are 4 times more likely to commit suicide than women. This month in June, it is Men's Mental Health Awareness Month. And today, I have a couple guests with me. I have Mike Melso, who served in the Marine Corps. And then we also have an active duty clinical psychologist who is going to basically help us navigate what we're talking about, why this month is so important.
My driver, who I thought was fine, everything was going well with him. When he was a Marine reservist, he wound up committing suicide just about 2 weeks after I left.
When your soldier or your sailor or your airman is acting differently than they usually do, that's when you sit up and take notice, and that's going to look different for each person. We don't see nearly the level of stigma when it comes to seeking mental health care or physical medicine as well, right? They're much more likely to seek help, whether it's from a regular doctor, from a mental health professional, and I think that's a really wonderful thing.
Welcome to In Search of Excellence Island Style, powered by the Broker Mortgage Experts. This podcast highlights leaders raising the standard through consistent, values-driven leadership, lived with aloha.
I posted something yesterday, and one of my high school classmates today just reached out to me online and said, this is so important. And I asked her to elaborate, and she said that her son, who was an airline pilot, took his life in October in 2023. And it was in large part due to his mental health not being right. And she was saying that this is a problem that we have in the pilot community, which actually should make this very important for everybody because most of us are flying. Matter of fact, I'm flying later on today. But I did want to talk about mental health awareness, men's mental health awareness. Some of the numbers, 1 in 8 men suffer from depression. And this isn't just military, this is across the board. Men are 4 times more likely to commit suicide than women. And although, what can I call you? Just Dr. Jenny?
Sure.
Dr. Jenny, we started this, and you were saying that number is coming down. Men are 4 times more likely to commit suicide than women. And why is that number coming down?
It's actually more to do with availability and comfortability with firearms. So historically, it wasn't so much that men were more likely to want to kill themselves than females. It was that men were more likely to do so using firearms, whereas the methods that women were using tended to be less lethal and more survivable. So historically, women would overdose instead, which was higher survivability. But over time, women have gotten to be more comfortable using firearms, using more lethal means of killing themselves. So we're starting to see that gap close.
And it's mainly because women are more comfortable using firearms.
Correct.
Wow. So it's not like we're solving the problem. It's just women are committing suicide more often than they were.
We're getting better at it.
We're getting better at it. Women are getting better at it. Wow. That's interesting. I never really thought about that. All right. So, Mike, got to get you in this conversation. You served in the Marine Corps. How many years did you serve?
Total 27 years.
27 years. How many deployments did you make?
I need both hands.
You need both hands.
Yeah.
So what are some of the things that you saw in the field during your time in service that were alarms, triggers for alarms on mental health awareness, just men who had mental issues or coping issues?
Funny enough, it wasn't in the field. It was in Garrison when I was in command that I really had to deal with a few of my Marines that had problems. And you wouldn't expect that. In the field, you would expect that people would be concerned, especially because you're being shot at, that whatever's going on in the environment and you're exhausted, you're not getting to sleep. So those breakdowns you would think would happen. But it was really in Garrison when I was in command that I saw that be the worst case. I did have a young Marine who was one of my clerks who wound up having to be hospitalized. Came into me, told me he was having real problems and wound up getting hospitalized twice. And then not long after leaving command, my driver, who I thought was fine, everything was going well with him, and he was a Marine reservist, he wound up committing suicide just about 2 weeks after I left.
Wow.
And that really hits hard because you expect to see something or feel something from that person. And in some cases you do, and you know it. Like the one guy I knew, and I said, okay, let's get you where we got to get you. But The driver, I had no idea. It was really a surprise when I got notified.
Doc Jenny, it doesn't surprise me that when service members are in the field or on deployment, that's when there's that sense of camaraderie. They're not alone out there in the field or on deployment. But when they get home, maybe they have a hard time adapting, and certainly it's not the same. When you're in the field, it's mission, mission, mission. When you get home, now you got the rest of the world to deal with. So what can you kind of elaborate on with that?
Yeah, you're absolutely right. When we're in the field, when we're deployed, we have a mission, we have a purpose, we have a focus, and there are very strong protective factors psychologically when it comes to that. Also, in a deployed environment, you don't have accessible some of the things that factor into mental health and suicidality that you do back home in Garrison, such as drugs and alcohol are a big one. So typically when we see suicide attempts, we also see drugs and alcohol in the system, disinhibiting that survival instinct, right? We don't have that available when we're downrange. And when you're in active combat operations, interestingly, combat is a protective factor, which sounds really weird, right? Because you're putting your life in jeopardy. So I think most people assume, I get this question a lot, most people assume if you have someone who's not doing well psychologically, who might be having suicidal thoughts, and now they're in a combat situation, isn't that a bad thing, right? How could that possibly be a protective thing? And we're animals, right? Our brainstem functioning takes over. That survival instinct takes over. No matter how terrible you feel, no matter how depressed you are, in that critical moment where you are trying to harm yourself, survival instinct can take over. And we tend to see a lot of suicide attempts before we get a successful suicide completion for that reason. Our survival instinct is very strong. You have to take that offline with drugs and alcohol use, often in order to complete a suicide attempt. So we really do see a very high percentage of drugs and alcohol involved in successful suicide attempts. So not only do you have that mission, that purpose factoring in as a protective factor when you're deployed, but your survival instinct is fully online in combat operations. And so in a weird way, it is very protective.
It's interesting. Obviously, the Army and the Marine Corps, they were the front line in many of our suicides in the military. What is it? Is it 22 a day? Is that kind of that number? I don't think it's right, but that's the number that we've seen, certainly in print. Much of those suicides that we're seeing are from those two services. But now, in this current war that we're in Iran, the Navy, and certainly for the last probably year, the Navy has been under fire, literally under fire, for the first time since World War II. And you have ships that are, and I've deployed to the Gulf, and there's not a lot of room on those ships to navigate. You are in close quarters, and the amount of attacks that they're taking, you are under constant mental strain, and you don't feel it as much. I think they probably are, but there's just what we were saying before. It's not like you have a doctor to go talk to on the ship. The doctor on the ship is going to give you Motrin and do some basic stuff, but get you back to work. And I think when we come back, the Navy, these people who have been deployed, and the stress for those in the Navy, and obviously I know the Navy because that's what I did. Long deployments for a year away from home, that's a lot of stress. Was it the Truman? No, not the Truman. The Ford? One of those two. They went from Venezuela to the Gulf, and they just came back, but they were gone for, I think, a year. That kind of stuff takes a toll. And really, I hope the Navy, and I know so many people who are still serving in the Navy, leaders in the Navy, I hope that they are taking a look at that, because that's something that we're going to see, I think, come, especially on these combatants. We got two destroyers from Hawaii actually in the Gulf right now. And a carrier strike group, probably an amphibious group. So they're under constant attack. I pray for them, really. Every night I pray for them, just because the stress, the mental strain that they're under right now is pretty big.
Larry, what year did you get out of the Navy?
What year did I get out of? 2016, December 31st, 2016, my last day.
Okay.
Yeah.
You'll be pleased to know the Navy has done a remarkable job of really putting their psychologists out into operational billets. even more so since you got out. There's been a big push for that, and it's been, I think, a wonderful thing for the Navy.
That's good. That's good to hear. Yeah, they definitely need it, especially now. So we were talking earlier offline about the old guard, guys like me and Mike, or Mike's the older guard, but guys like me and Mike who we are the stigma of we don't ask for help. And this is one of the reasons why men commit suicide more, the machismo, the stigma. We can do this alone until we can, but we're afraid to ask for help. There's a lot of stuff on that, but what about this generation, the millennials, maybe the Gen Z that are serving now? They're a lot different than we are.
Very much. And the majority of our military are that 18 to 26-year-old crowd. So we're looking at Gen Z in particular when we talk about our younger generation in the military now. And I have to give Gen Z a lot of credit for this. We don't see nearly the level of stigma when it comes to seeking mental health care or physical medicine as well, right? They're much more likely to seek help, whether it's from a regular doctor, from a mental health professional. And I think that's a really wonderful thing. Our system here in America, as far as our number of providers that we have available, I think is struggling to keep up with demand because of that. So both positives and negatives to that trend that we're seeing. But I think our younger service members are much more likely to come in and seek help, and especially earlier on.
Yeah, we were talking about that pendulum swinging, though. So, again, you had guys like Mike and I not asking for help. And now we were saying that you're going to see a doctor because you got a paper cut generation. Kind of how are we kind of trying to keep things to the center where we're taking care of them, but we're not coddling service members?
So that's part of my job, really, and the rest of our surgeon teams in the military is we still teach the same way we always did, right? Self and buddy aid. How do you take care of yourself first? How do you take care of your buddy to your left and right? You may not always have a doctor available, especially in combat operations. You may not always have a medic that you can scream for. So we still want to train our service members to be able to foundationally take care of themselves and the people around them. So really reinforcing those principles of psychological first aid.
So let's talk a little bit about that. I think I read a lot. I listen to a lot of different podcasts. And Mike, I'll pass this one to you. What do you do to take care of your mental health? What are ways that you kind of stay in the game?
Yeah, so that's a really good question. And I was thinking about it as the doc was discussing, is that it's a matter of self-awareness. You don't know what you don't know. So is something that I do, something that I say, the way I react to things, the way emotionally I react to something, is that wrong? And who tells me it's wrong? Because that's just the way I've always done it. So that self-awareness piece is probably really a challenge. But for me, to stay balanced, it's a matter of working out. My PT, my run, my lifting, whatever, to help me level off and be the guy, the husband, father that I want to be. So that's a big part for me. But it's that self-awareness. And we weren't socialized, men, young boys at our age, hate to say that, but we weren't socialized to show our feelings and all and talk to somebody for help. So it's somewhat of a challenge and a barrier you have to get over to be honest with yourself and get the help that you need. And that help doesn't mean that you are damaged.
Yeah, you don't have a problem.
No.
It's not, you're not faulty.
Yeah, it's something that we all can benefit from if you can have that self-awareness and be honest with yourself.
Yeah, I think for me, this morning before we came in, I went surfing. I was thinking about what we're going to talk about today while I'm surfing, and it was so nice. The sun's out, sun's hitting you, the water's cool, perfect waves too, nice little south swell. But it's what do you do with your body in your free time? What do you put in your body? What do you do to your body? You work out. I work out every day, doing something. I love surfing, golfing. Although golfing sometimes mentally doesn't help me. Sometimes it hurts. But doing something to hiking, And doing it, you can do it alone. Obviously, you surf alone. I don't really feel like I surf alone. I'm always with a group of people, but meeting people, but hiking. And this Hawaii is a perfect place to kind of gain control of your mental health, or to understand your mental health and take care of yourself. But it's not just what you do; it's what you put into your body. It's not. I'm not talking alcohol. Obviously, alcohol, and that's something. Actually, my next question for you will be the alcohol and drugs in the millennials and Gen Z. But how do you feed yourself? How much sleep are you getting? All those things, I think, weigh into your psyche and how you feel about yourself mentally. The food you eat, eating right before you go to bed, eating junk food because you're stressed out, that doesn't help. I know. I drive past McDonald's every single freaking night when I'm coming home from something, and all I want is a McFlurry and French fries. But I know that's not the right thing for me to do. But some people just go ahead and do it. And you got to take care of your body, what you're putting into your body. Eating. I was just listening to a podcast on sleep, getting good fiber into your body, giving yourself 3 hours or so, and everyone's a little different. 3 hours or so from the time you eat to the time you go to bed. Trying to get 7 to 8 hours of sleep. I've been working on that. Actually, I got 8 hours of sleep one day this weekend. I was shocked, but my body felt good. It's something that we need to take care of. So, Dr. Jenny, what about alcohol and drugs with certainly our service members now? And I know my son doesn't drink. He's 21. He doesn't drink. My 30-year-old doesn't really drink much either. Guys like Mike, and I'm speaking for you, Mike, we drink. We drank a lot. Our parents drank a lot. I think, I'm not speaking for everybody, but every one of my parents, and I have 6 because my parents were married 3 times apiece, they were all smokers and they all drank and had varying degrees of alcoholism. But we're not seeing that, are we?
You're absolutely right. It doesn't surprise me to hear about your kids at all and their alcohol use. I think the younger generation is much less apt to drink alcohol. I've actually heard a lot of liquor companies are struggling financially.
E.J. Gallo, the largest manufacturer of wine in the country, just shut down one of their plants.
Wow.
Yeah.
Wow. Yeah, definitely not our generation, right? I'm the generation of the wine moms. So getting together with the other stroller moms and having your tumblers of wine. But no, this younger generation, we don't have the same number of alcohol-related incidents. It's more drug-related, especially with how easy it is to obtain different substances that may be legal where you're living, but are not necessarily legal, quote unquote, in the military. So we do have those issues that we're seeing. And unfortunately, I think there's a false sense of security when you're dealing with substances that are legal. And this was certainly the case with alcohol for our generation as well. We think if it's legal, it's perfectly safe, it's perfectly fine, everything in moderation. And that's not necessarily the case, right? So there's things you can get at gas stations and vape shops now that are quite dangerous.
Why aren't vapes illegal in the military? I hear it, and I don't know. I can't speak, but I watch stuff, and it sounds like there's no health benefit to it. Not that there's any health benefit to cigarettes either, but it just seems like you're putting these different substances into your lungs, and it's deteriorating your lungs even more, I think, than cigarettes. I don't know.
That's a good question.
I don't know. You're not really that kind of a doctor, though.
I hear it tastes good. Other than that, I'm not sure what the allure is. I think we're still very much trying to understand what the allure of vapes is so that we can get out in front of that and address that. And I think certainly it was those same questions in the 80s when kids were smoking cigarettes, right?
Yeah. Yeah, everyone, I think my mom's generation, everybody smoked cigarettes. All 6 of my parents smoked. I hated cigarettes, and I'm still not, I still don't smoke cigarettes,
But for a lot of people, the allure was the same as caffeine. Being able to stay awake. You've got, as Larry Heights is drink. And certainly that was the case for the military too, right? We always promoted, so historically we're talking wars of old, right? We always promoted cigarette use. They were handed out as part of your rations to help you stay awake for long patrols that could go overnight, could go multiple days, right? And we know caffeine has a wonderful effect on the brain for alertness, which helps you stay alive in combat operations. So there was definitely a reason why we promoted that. Now that's not going to be the same for vapes.
No, I remember. Yeah, the coffee thing that's our lifeblood in the Navy. I remember my grandfather was in the Navy. He was a warrant officer. He was a chief medic in World War II, and he liked his coffee black. And he died when I was 4, but my mother carried that on, and I started drinking my coffee black, and that's just it's a historic. Coffee's everywhere,
Yeah.
and
Yeah. But when you're out in the field, when you're out on patrols for hours at a time and you run out of coffee, you need your chew, you need your dip,
yeah,
you need
no,
your
for
alternate
sure. For
alternate
sure.
options.
So, as a clinical psychologist, when you get service members come in, how do you help them? What services does the military provide to help service members? Can you take care of their mental health?
Yeah, we have everything that you have on the civilian side. We have individual therapy, group therapy, marriage and family counseling available, access to medications either through your primary care physician or through a psychiatry team as well. We have outpatient mental health clinics. We have intensive outpatient, which are all-day programs where you go home at night. So for folks who have more severe levels of mental illness that outpatient isn't really getting at, we've got higher levels of care. Inpatient, we have access to residential treatment, really any and all levels of care available.
Now, if you're kind of giving them medication, I would think for me, I'd be fearful of taking medication to help my mental health because it might impact my security clearance or my ability to do my job. Is it not that type of medication, or is there that a medication that you can get that won't kind of cause you to lose your security clearance? Because I think a lot of people, I would think, that wouldn't want to go talk to a doctor because they're afraid, they're not going to let me do my job.
Right, right. So I'm going to say it depends because all psychologists answer every question with it depends. So for the most part, it does not impact your ability to do your job, your deployability, your security clearance, but there's always going to be exceptions to that, right? Like everything else. So depending on what your very specific job is, there may be additional restrictions because of the kind of information that you have to have access to or the type of job duty or assignments that you might have, right? So I think most people wouldn't be surprised to know that the rules are different for special operations personnel than they might be for a typical soldier or sailor, right? You mentioned aviators before. Rules are much tighter when it comes to any kind of medical treatment, including mental health, any kind of prescriptions for anything when it comes to aviators. I would say they're probably the most tightly regulated group when it comes to what they can be prescribed or put in their body. So it really depends on what you do, but for the most part, and I do security clearance evaluations all the time, you can have a mental illness, you can be on medication and still hold a security clearance, and there's really no problem with that. Caveat being it depends on the mental illness, right? So anything that would be severe enough to potentially impact your security clearance, we're probably looking at whether or not you can even serve in the military at that point, like schizophrenia, that level of mental health issues.
So let's talk about young men in particular who are wanting to join the military. Now, the numbers when I was active duty were like only 35% of men who are able to serve, of that age to serve, actually qualify for service because of physical or mental, drugs, jail. And I think that number is closer to 1 in 4 now. Only 1 in 4 are qualified. And that 1 in 4, that 25% that can actually serve, the colleges want them, Amazon wants them. And so the military has a tough time competing. Is there a way for us to get from 25% of men being able to serve to maybe 30? Is there a way to get up there with taking care of mental health before they get in? It's an investment. It's a gamble.
So that's a difficult question because I think the largest barrier that I'm tracking to entrance into the military is actually obesity, is weight management. So there's certainly a mental health component to that. So if we're going to talk mental health specifically, it's not typically mental health diagnoses per se that I think are causing the eligibility issue. But insofar that mental health might be a part of the obesity epidemic, I think that's really where the juice is for us to target.
Yeah. No. So what you're saying is obesity is the mental health kind of
Can be.
is a mental health issue.
Can be, yeah. And I wouldn't want to oversimplify it by calling it that, because I think there's a lot of cultural and systemic factors, environmental factors that go into that, right? Not only from upbringing, but also just being here in the United States. We're a plus size culture.
We are. It's so funny. I went to boot camp in 2009, I think was the last time. And I remember the CEO of Naval Station Great Lakes was talking to us, and he was saying, we went through the mess hall, and I know when I was going through coming in the service, we didn't have soda. We didn't have pizza or junk food, but they had, and we didn't get served coffee. Did you get coffee at boot camp? Maybe you did.
Yeah, I think we had coffee available.
We didn't have coffee. But we didn't have soda. But soda is such a part of everybody's diets that they're addicted to it. They serve it, but that's not good for your bone density because they're getting soda, they're not getting calcium. So there's a lot more stress fracture, a lot more injuries. And they're trying to do so many things at boot camp, and I would imagine it's the same with the others. The area they run it's like a soft, rubbery,
Shock
flooring.
absorbing track.
And they're still getting injured. It's still getting injured because their bone density is so thin because of the diet. Speaking of what you put into your body.
So, if we could, Dr. Jenny, if we could talk about the various age groups of the men, the younger military, and then the guy who got out and is in the civilian world, and target those age groups and probably what are the risk factors?
For mental health conditions or just lifestyle concerns?
What are the risks for them to potentially struggle within the military and then when they get out?
Yeah. So I know we've talked a lot about our younger generation already, our Gen Zers, but I want to caveat this with a reminder that the military is very much a microcosm of society at large, right? So we're talking a lot about the armed forces today, but certainly this is all very applicable to men, at least in the U.S., is what we're talking about predominantly. Any of this is really relevant to any men who are listening or men who are your loved ones, regardless of whether or not they're in the military. So our younger generation, we talked about already, they're more likely to seek help. They're more likely to recognize that they need help, which is wonderful. More likely to utilize services, which when they are available is wonderful. But I think mainly what we see on the military side with our Gen Z population is just difficulty adjusting coming into the military. And that is no different than any generation before them. It's always been that way with our 18 to 24, 18 to 26-year-olds. It's a big change coming into the military. Leaving home, leaving your hometown, leaving your social support back behind you. It's also during a time in your life where you're transitioning to adulthood. So it's actually multiple transitions that are happening at once. And even if you don't join the military, if you go away to a college or university setting, or you go right to work, move out of mom and dad's home, all of those are really big transitions. And I would say, as a clinical psychologist, the data supports this, my experience supports this. Your 20s are probably the hardest time of your life when it comes to all the different all the different transitions you're going through. That's when you're becoming an adult, you're trying to figure out the whole adulting thing. You've got all these responsibilities. You're ready and raring to go, and you're going to have a lot of failures, and you're going to mess up some things. And you've got your marriages and having kids and your first jobs and just all of that stuff. It's a very volatile time in your life. We certainly see that play out in the military quite a bit as well.
You can't forget student loan debt.
Student loan debt.
Hundreds of thousands of dollars of student loan debt. Getting a job. And I certainly, young adults are not getting married at the rate that certainly they did in my generation. They're not having kids. So is that almost a protective decision on the part of that person saying, I got enough stress already. I don't need a kid. I don't need a marriage. But really, people need friends. People need somebody to talk to.
Correct. And leaving your hometown, leaving your friends and your family. and having to pack up and move across the country and essentially make new friends wherever you land it's tough, especially for this younger generation who a lot of their social skills have been developed online and not necessarily face to face. So that can be its own challenge.
And during your mid-20s is a time when mental illness can be a factor.
And what Mike's referring to is for those who might have a genetic susceptibility to more serious mental illnesses, for them it's not uncommon for that first time, talking about psychosis, for example, a first-time psychotic break or first-time episode of a serious mental illness can occur most commonly in those early 20s, especially if there's a big stressor involved, like basic training or SEER school, something like that.
That brings up like a couple of different things for me, and I'm all over the place. So, just you should be used to that by now, and you probably already saw through me on that one. But so, if you are you don't have to be a man, a woman, or if you have a somebody, what are some of the signs that a man who you know needs assistance? What are some of the things that you can look for that are key tellers that this person should probably talk to a doctor, or just maybe how do I talk to somebody like that? What can somebody who's observing this do to help that person?
The best data that we ever get is from loved ones. And I think all doctors would agree with that, right? And Mike mentioned self-awareness before. So sometimes our loved ones can pick up when we're not doing okay a little faster than we can, whether it's a not wanting to admit it to ourselves or just not having that self-awareness because you're eyeballs deep in whatever your stressors are, right? So in the military, that could look like your battle buddies are really going to notice before you do, or your spouse if you're married. And I would say it's very specific to that person. And this is something I tell commanders all the time, is when your soldier or your sailor or your airman is acting differently than they usually do, that's when you sit up and take notice. And that's going to look different for each person. Now, there are some universal things to look for when somebody's struggling mental health-wise, right? Inability to regulate their emotions, inability to perform their duties on a day-to-day basis, things that are normally very simple for them, things that are programmed into muscle memory, not showing up to work on time, hygiene looking all over the place, irritability, anger, lashing out, especially to somebody who's above you in the chain of command. Anything that's unusual behavior or that's a deviation from the norm for that person would be concerning. In the case of more severe mental illness, what's been very surprising to me on active duty is how often severe mental illness is not noticed when you would think that would be the most noticeable issue, right? So I've had some service members have a first-time psychotic break who wind up being schizophrenic, which is not a very common disorder. It's about 1% of the population who suffers from that. But if you're going to have that first-time psychotic break, it'll typically be in your early 20s, which might be when you're serving in the military, right? And I would think somebody who is actively psychotic would be noticed right away. I've been very surprised that hasn't been the case. And I have to give credit in a weird way to the military for that, because we are very accepting of people for whoever they are, for however they are. And so sometimes some of those early signs of serious mental illness go noticed, but not necessarily flagged as problematic, because we are very accepting of people. So we might have some folks who are starting to have delusional thought processes and some weird ideas that are precursors to more serious mental illness, and it just doesn't get noticed.
Does that happen any more in today's service than it did back in the day,
As far as
so to speak?
prevalence rate?
Yeah,
No.
prevalence rate.
It'd be the same.
All right, so
Pretty consistent over time.
the older group that I asked you about also, what are some of the things, the risk factors and some of the big stressors?
So our older, I hate saying the word older, that feels very mean. Our older population, I'm one of the older population too. Just
The more experience.
our more senior experienced personnel in the military. Those of us who remember 9/11, I think we could just lump all of us into the same category, right? Our stressors are going to be more, I'll say what I've seen anyway. You've got more combat vets in that generation, which we don't have a lot of left anymore in the military because of just retirement ages and how long it's been. And that may change here in the near future, of course, but our senior NCOs and our more senior officers are the ones with that combat experience. They carry that with them, right? So we might have more incidence rates of post-traumatic stress disorder related to combat operations, but also just high stress in general, right? The stress of leadership. And as you go up in rank, the more people you're responsible for. You've got your family, you've got your kids going to college, you've got your midlife stressors are going to be the same whether you're in the military or outside the military, but you might have that combat experience in the background on top of that.
A bunch of gunny highways from, what was that, the Heartbreak Ridge?
Yep, Heartbreak Ridge.
I saw something on that this week. I made my son watch Full Metal Jacket this weekend.
Oh, did you?
Yeah, and he was kind of, at first he's like, this is kind of weird. It's kind of funny, and he was like, I don't get it. And then the movie totally changes into war and just...
It's
and
two movies in one, isn't it?
Yeah, and he was taken aback by just how violent and just emotional that second half of the movie was. But speaking of...
So is it appropriate in this podcast to say...
No.
When Joker asks the question...
I know exactly where he's going. No.
No, I said that in jest, of course, but that change, that line really shows really was a big part of that change, and then it gets ugly after that.
Yeah.
But in the first part, in the boot camp part, not that the suicide was anything to laugh off and all, but it changes quite a bit.
Oh, you remember that generation too. We had that, and we had Officer and a Gentleman, Louis Gossett Jr., and their movie. And those kind, I think, obviously, Officer and Gentleman came out before, but those were the movies that kind of came out. You had Rambo, that strong machismo man, and that's what we grew up with. And certainly, my dad related. He was a Vietnam vet. So, President Trump signed a document. I should have done a little more research on it, but basically allowing hallucinogens or the use of different psychotic drugs for, I don't know if it's for active duty, but made them legal, I believe. Joe Rogan was there at the signing. This happened maybe a month ago.
What, psychedelics?
Psychedelics, yeah.
I'm not tracking that. I'd have to look into that and get back to you. I was tracking some look into studying that for veterans or for service members and looking at that more closely on the research side. But as far as openly allowing it while serving, I'm not tracking that.
Yeah, I know certainly after service, maybe not while in service, but after service, it's not legal in the U.S. A lot of people go down to Costa Rica or Mexico or other places to do the psychedelics, and it supposedly helps.
The VA has been a strong leader in that as far as doing the research on if that can assist with, especially with PTSD is where most of that research is.
And there are a lot of, in our generation, the folks who are getting out of the service now, everyone who served in OEF, OIF, but those people who served are the ones who have the largest amount of PTSD issues. I'm just curious if any of that had made its way, you guys, to active duty military.
Just in the research sense. So we've had a couple different sites in the military that are participating in some of those research studies to see if that's something that we should be incorporating into our repertoire of treatment for service members in the future.
Okay.
So, if I could, Larry, as we get close to wrapping up, can we talk about the resources available?
Yes.
Yes. So...
Thanks, Mike.
Yeah, absolutely. And we were talking about the different age groups and everything as well. And so certainly that last age group, although it's not specific to any particular age, but the last population I was going to mention is our veterans, as our folks that have previously served and are no longer on the active duty side or reserve or guard. And so those individuals, of course, have the VA available to them. If you have served in the military, you have the VA available to you, period. So that is also the case even for individuals who were discharged from the military under less than honorable circumstances. So a lot of people think that they don't have access to that care anymore if they get kicked out for doing naughty things. That is not true if you served. And so the VA has an enormous number of resources available for our veterans, both medically and mental health-wise.
That's super important, because a lot of people don't know that. If you get kicked out, admin separation, the big chicken dinner, bad conduct discharge, dishonorable discharge, obviously you don't get a VA home loan benefit, but you still get access to treatment. That's pretty good. So if you're, for the audience, and you think you want you may need help. You may want to seek assistance. Not that you need help. You may want to seek assistance. What can they do? Whether they're active duty or besides going to the VAs or anything else out there. Because what about non-veterans? I know obviously you're in the military, but what about for non-veterans? Because it's not military men's health awareness month. It's men's mental health awareness month.
Yeah, absolutely. I think the most important thing to do if you're not sure, especially if you're having any misgivings, and we've talked about men and stigma, and if you don't really know if you need help, but you're sitting on the fence. And I think where a lot of people are is that pre-contemplative area is what we call it, where you think you might need help, but you don't necessarily know, or you may not want to admit it to yourself, and you just sit in that discomfort space for a really long time. Most folks who wind up eventually getting help wish they could go back in time and just kick themselves in the butt and get that help sooner than later. Would have saved a lot of their relationships, would have saved a lot of headache, a lot of drama in their life. So if you're not sure, I would encourage everyone to consider that your family physician, your regular doctor, whoever you would go to if you have a cold, if you have the flu, if you need a vaccine, right, wherever you get your physical done, that is a great first place to go to discuss your mental health. And if your family physician, your PCM is not asking you about your mental health, they're wrong. They should, because your mental health is a really important part of your physical health, and we shouldn't be thinking about those as two separate things. 85% of psychiatric medications prescribed in this country are prescribed by someone's primary care provider.
And it's interesting. So TRICARE, when I go to Desmond, I always get a form to fill out asking me, have you had suicidal ideations?
Basic depression,
basic depression type stuff. Mm-hmm. And every time I go, I'm like, I got answers. But I guess there's a reason.
Yep, absolutely.
Because somebody's going to put yes.
And it's just like you said, Larry, it's your nutrition matters, your fitness and exercise matters, your lifestyle factors matter. All of that stuff is interrelated. Your mental health is not this thing that's separate and distinct from your physical health, right? And the more we think of it that way, the more we reinforce stigma, right? It's your brain, your mind, your emotions. It's a part of who you are. It's no different than taking care of any other type of healthcare issue that you have. So a great first place to go would be to your regular doctor and talk about that. And they can help do that initial screening and let you know, is this something that you should be worried about? Is this something that you should look further into? And they will be able to get you to the right place. I think a lot of folks will go right in to see a specialist. And if they're not able to articulate what they're experiencing, or if they have a bad experience with that particular specialist, they just get turned off from the field. And it's like, I knew I shouldn't have bothered with this. I shouldn't have looked into that. And then we've lost somebody that we could have helped, right? But your family physician, generally speaking, is somebody that you already have a relationship with, somebody that you already seek help from, hopefully on a regular basis, especially men who are married. Our spouses make you go in whether you like it or not, right?
I am so bad about that. Oh my gosh.
And a lot of men are.
And it's nothing personal. It's just,
No, I know.
It takes me out of my I got to go up to the doctor. I got to make an appointment. But it's important. Yeah. I tell folks this all the time about getting their disability rating. If you didn't get it when you got out of the service, just do it. Just take the time. It's not the money. The money's obviously good, but it's the treatment that you deserve because you served. And less than 1% of Americans have served. You don't feel like you're taking advantage of the system. No, the system owes you.
It's there for you.
Yeah, it's there for you. Real quick, we're going to wrap this up, but we have a homeless problem in the United States. You talk about mental health. I think a lot of it's the mayoral race in LA is really bringing a lot of this to light. And I think that's good. But what can we do to help end homelessness? Spencer Pratt's talking about it's not a homeless problem, it's a drug problem, but it's a mental health problem. Right. At the core. What are we doing in the medical field? Maybe it's kind of by state or locality. What are we doing to stop homelessness and take care of those people who are homeless we'll say in Hawaii, for instance?
Yeah, and it's such a complex problem because people have choice, right? People have autonomy. And whether you're mentally ill or doing drugs or not, you're still a person, you're still a citizen, you still have rights, you still have choice, you still have autonomy. So we can't just throw you into a facility and lock away the key and force you to get help. That person has to be willing, able, and wanting to receive that help. We had a big transition in the US in the 1980s. So I'm going to take you back in time a little bit. We had mental health institutions that were residential in nature for folks. Many of the type of folks that you see these days that are living on the streets would have been living in those facilities back then. And those facilities were funded by our government. And in the 80s, all of those facilities were shut down, lost their funding, and it caused a huge, I was going to say influx, I guess outflux, whatever, outflux of our homeless population because we lost those institutions. And taxpayers make these decisions, right? How much are we willing to pay to help these folks? If we don't want them on the streets and you want them to get help, then that's something that as a society we have to determine is a value to us that we're going to pitch together and do something about or not. Right, and ultimately that's a taxpayer decision, and that's why it's important that we educate ourselves on these issues and know what the options are and make that decision and get to the polls and vote accordingly.
Dr. Jenny, thank you so much for really coming on today. And again, this is important to me. This is important to America, that our men are there and realize that they are not alone. We are not alone in kind of taking care of our mental health, and talk to somebody. Don't take matters in your own hands to the sense that you're going to hurt yourself, because everybody is valuable. And it's so funny. We were talking about the homeless people, and I was at the beach today. I was talking to a family at the beach, and this one girl, her son, they were visiting from, I think, Georgia or something. Her son, who's 2.5, maybe 3 years old, was talking out the window to the neighbor's son. They were like window talking. And the child gave him his toys. And they were really good toys. And you think about how innocent those two boys are. They don't care about the value. The value isn't the toy. The value is the relationship. The value is caring and giving. And we were talking about, like, what happens? We all start out like that. And I think of the homeless person. I think of the man who's ashamed of his past. We can get back to that. We can find that not the innocence, but that sense of giving, that sense of service to others. I think people feel better about themselves when they serve others. Yeah. It's just that self-fulfilling, I did something for somebody else. And that's one of the reasons why I do this podcast, because I want to help other people and bring to light these issues that we're going through. And it's not going to go away, but we can mitigate it somewhat if we just talk to each other and don't be afraid to ask for help. So again, Dr. Jenny, thank you so much for coming on today. Always a pleasure to see you. And stay tuned for next week's episode. I don't even know what it's going to be about. Oh, I think I know what it is. I'm talking with Jade, my partner in crime. But again, thank you so much, Dr. Jenny. And
thank you for having me.
Have a great day. Aloha.
Thanks for tuning in to In Search of Excellence Island Style. Stay connected for more conversations with leaders raising the standard through purpose, values, and aloha.